The CPT, current procedural terminology, guidelines for the integumentary system provide instructions and rules for coding procedures related to the skin, nails, and subcutaneous tissues. Here are some key points from the CPT Integumentary System Guidelines. 1. Excision procedures. 1. Excision codes are categorized based on the size and depth of the lesion, including margins required for complete excision. 2. Select the appropriate code based on the greatest diameter of the lesion, including the margins. 3. If the excision involves a malignant lesion, the code should be selected based on the biopsy or pathology report, even if the clinical measurements differ. 1. Repair procedures. 1. Simple repair, closure. Codes are used for superficial wounds that do not involve extensive undermining or layered closure. 2. Intermediate and complex repair codes are used for more complex wounds requiring deeper tissue involvement, layered closure, or reconstruction. 1. Biopsy procedures. 1. Biopsy codes are used to report the sampling or partial removal of skin and/or subcutaneous tissue for diagnostic purposes. 2. Codes are selected based on the type of biopsy, e.g., punch biopsy, incisional biopsy, or excisional biopsy, and the size of the lesion or specimen. 1. Destruction procedures. 1. Destruction codes are used to report the removal or eradication of benign, premalignant, or malignant lesions by various methods, e.g., chemical agents, electrosurgery, cryosurgery. 2. Codes are selected based on the size, location, and method of destruction. 1. Lesion removal procedures. 1. Codes for lesion removal, other than by excision, are used for procedures such as curettage, electrosurgical destruction, or laser ablation of benign, premalignant, or malignant lesions. 1. Adjacent tissue transfer or rearrangement. 1. Codes for adjacent tissue transfer or rearrangement are used when moving tissue from one area to another to repair a defect caused by the removal of a lesion. 1. Mohs micrographic surgery. 1. Mohs micrographic surgery codes are used for procedures involving the removal of skin cancers layer by layer and immediate microscopic examination of the tissue margins until the cancer is completely excised. 1. Biologic and synthetic implants. 1. Codes for biologic and synthetic implants are used when placing materials into or onto the skin or subcutaneous tissue for reconstruction or augmentation. It's important to consult the complete CPT manual and review the specific guidelines and instructions for the integumentary system to ensure accurate coding. Familiarity with the guidelines will help ensure proper coding and documentation for procedures related to the skin and its associated structures. Each subtopic with examples. Certainly. Here are some subtopics within the CPT Integumentary System Guidelines along with examples. Excision procedures. 1. Example. Excision of a malignant skin lesion on the arm with a diameter of 1.5 cm, including margins. 2. Code. CPT Code 11603 Excision. Malignant lesion including margins, face, ears, eyelids, nose, lips. Excised diameter over 1.0 cm but not over 2.0 cm. Repair procedures. 1. Example. Layered closure of a deep laceration on the leg requiring sutures. 2. Code. CPT Code 12032 Repair, intermediate, wounds of scalp, axillae, trunk, and/or extremities, excluding hands and feet. 2.6 cm to 7.5 cm. Biopsy procedures. 1. Example: punch biopsy of a skin lesion on the back with a diameter of 0.8 cm. 2. Code: CPT code 11104 biopsy of skin, subcutaneous tissue and/or mucous membrane, including simple closure, unless otherwise listed. Single lesion. Destruction procedures. 1. Example: cryosurgery of a benign skin lesion on the face with a diameter of 0.5 cm. 2. Code: CPT code 17110 destruction, e.g., laser surgery, electrosurgery, cryosurgery, chemosurgery, surgical curettement, of benign lesions other than skin tags or cutaneous vascular proliferative lesions. Up to 14 lesions. Lesion removal procedures. 1. Example: laser ablation of a premalignant skin lesion on the arm. 2. Code: CPT code 17000 destruction, e.g., laser surgery, electrosurgery, cryosurgery, chemosurgery, surgical curettement, premalignant lesions, e.g., actinic keratoses, first lesion. Adjacent tissue transfer or rearrangement. 1. Example: transposition flap closure for a defect on the nose caused by the removal of a skin lesion. 2. Code: CPT code 14001 adjacent tissue transfer or rearrangement, forehead, cheeks, chin, mouth, neck, axillae, genitalia, hands, and/or feet. Mohs micrographic surgery. 1. Example: Mohs micrographic surgery for the removal of a basal cell carcinoma on the scalp. 2. Code: CPT code 17311 Mohs micrographic technique, including removal of all gross tumor, surgical excision of tissue specimens, mapping, color coding of specimens, microscopic examination of specimens by the surgeon, and histopathologic preparation including routine stains. Biologic and synthetic implants. 1. Example: placement of a synthetic mesh for reconstruction of a large abdominal wall defect. 2. Code: CPT code 15734 muscle, myocutaneous, or fasciocutaneous flap. Trunk. Please note that the examples provided are for illustrative purposes only. It's important to consult the complete CPT manual and follow the specific guidelines and instructions to accurately code procedures within the integumentary system.